The two doctors will give us an update with AHA and also the number of cases. Dr. Lau, good afternoon. Let me brief you on the situation of AHA. We have 2,585 confirmed patients hospitalized, 343 of which are newly confirmed patients. For those who required isolation facilities, we have 1,531. 552 are in isolation wards, 190 in Tier 2 isolation wards, 599 in Infection Control Center of North Lantau Hospital, and 190 are in AWE COVID Treatment Center. Among them, 232 are newly confirmed patients. Yesterday, we newly reported 5 cases in critical condition, 12 in serious condition. For those confirmed inpatients, 47 are in critical condition and 45 in serious condition. Among them, 13 critical patients are receiving ICU treatment. For cases of death, we've newly reported 13 cases of death, 8 male and 5 females aged between 54 and 97. Of these 13 cases of death, 10 have not received a total of 3 jabs of vaccines. And among the 10, 5 have never been vaccinated. So we appeal to the public once again. Vaccination against COVID is most effective in preventing serious conditions and even fatalities. So if you have not even received 1 shot, please do so as soon as possible. If you got the first dose, receive the second and the third and even the fourth dose as soon as possible. This is the only way to protect you. In case you have contracted COVID, it can prevent you from getting serious conditions or death. This is particularly true for the chronically ill and the elderly because they are usually not so strong. So they should receive the vaccine as soon as possible to boost their immunity. So in the unfortunate event that they are contracted, they can still be protected. And then let me brief you on the cases of death. 3 of the 13 who passed away had no vital signs on arrival to A&E department. The first is a 93-year-old male. He had never received 1 single shot of vaccine. He had hypertension, hyperthyroid, and Parkinson's disease, and also prostate cancer. On the 22nd of August, he tested positive by RAT. He had cough. He went to see a doctor. He was arranged to do a PCR with a CT value of 11.3, quite high. He was also prescribed oral COVID drug. And on the 29th of August, he was found unconscious at home. The ambulance was called and he was given resuscitation. On arrival to the A&E department, his condition was very poor and resuscitation failed and he passed away at the A&E department. After his death, another PCR test was done and the CT value was still low. It was 17 odd. I understand that for this elderly man who passed away, he did right to see a doctor as soon as he felt unwell. So we appeal to the public again. If you feel unwell, you should do an RT as soon as possible. And if you test positive, you should see a doctor as soon as possible so that you can be given oral COVID drugs. So long as you're over 60 and you see a designated clinic or a telemedicine or a GP with the oral COVID drug, you will be prescribed the medicine to lower the need for hospitalization or developing serious conditions. And even if you're already taking the COVID drug, you should be careful of your own condition. Has a shortness of breath increased, you're still in fever, and you still feel unwell, you should see a doctor again. You may need hospital treatment to prevent the case from deteriorating or even resulting in death. Another 84-year-old female who passed away at an A&E department. She had some chronic diseases, including diabetes, heart failure, and also chronic renal disease, and also coronary heart disease. She had never been vaccinated. On the 28th of August, family members found her breathing very poor. Let me check. Rather, on the 29th of August, that is yesterday, family members found that her breathing was poor and she became unconscious. So they called an ambulance to send her to the A&E department. RAT tested positive. Resuscitation was given at once to no avail, and the patient passed away on the 29th of August. This patient and also the one I described earlier had never received any vaccine. They are elderly. If they had received some vaccination, their conditions might not have deteriorated so quickly. So if you have an elderly relatives at home and they have never been vaccinated, you should help your elderly family members to receive the vaccine as soon as possible. Another case, 84-year-old female. She had diabetes, hypertension, hyperlipidemia, and also heart fibrillation, and also kidney disease. On the 27th of August, she tested positive by RAT at home. On the 28th, she started to have poor breathing, and she fainted. She became unconscious. Family members called the ambulance for resuscitation, and she was taken to the A&E department of Prince of Wales Hospital. Resuscitation was done, but then unfortunately she passed away on the 28th. Another case, and also other cases with chronic diseases, an 85-year-old female with one shot of vaccine. For the previous case, the 84-year-old female, she had 3 shots. And then we have another 55-year-old female with 1 dose with diabetes, hypertension, renal failure, a history of fibrillation of the heart, and also anemia. On the 24th of August, she tested positive through RAT at home. She started to feel unwell with cough and also shortness of breath. On the 25th of August, she attended an A&E department. She was tested positive by RAT. A PCR was done with a CT value of 18.3, and chest X-ray showed that the lower part of her lungs were opaque, and remdesivir was prescribed, but unfortunately she passed away on the 29th. Another is a 33-year-old male with no vaccination at all. He had a history of cancer in his esophagus and also colon. He had colon cancer. He had also renal disease. On the 27th of August, he tested positive through RAT. He had never seen a doctor or taken any medicine. And on the 26th, he had poor breathing. Family members found him rather unconscious, and response was slow. So an ambulance took him to the A&E department, RAT negative and PCR 30.1, and he was admitted to a medicine ward, and he passed away on the 29th of August.
The patient had a lot of chronic disease, and he had records of cancer, renal failure, and at the time he did not choose to get vaccinated. And after being confirmed infected, he did not take medication. So we repeat once again, 83 years old, they're elderly, and they have chronic disease. So if they took early medication, it would have helped. An 80-year-old male, no vaccination record, has hypertension, uh, cholesterol, Parkinson's disease, enlarged prostate. On 24th of August, he started to have difficulty in breathing and a fever. On the 25th, he arrived at A&E. At A&E, they conducted RAT and had a PCR test of 18.4, and he was prescribed Reservidir, but he died on 29th of August. A 97-year-old female had vaccination twice, has diabetes, high cholesterol, and on 18th of August, she attended A&E because of difficulty in breathing. But before arriving at A&E, she had a cough and phlegm. Blood oxygen level, the saturation level was low. She was admitted to hospital, and at hospital, she was given an X-ray, a lung X-ray, and we saw that the lungs were opaque, and she was prescribed Reservidir, but unfortunately, on 29th of August, she passed away. The next 74-year-old male has 2 vaccination record, has Parkinson's, anemic, had brain hemorrhage and also a stroke. On 27th of August, he attended A&E because of a fever, and he wasn't feeling well, was short of breath. He conducted RAT at home when tested positive. So at A&E, when they took a lung X-ray, it was opaque. He was admitted to hospital. CT value was 16.3. It was prescribed Reservidir, but unfortunately on 29th, he deceased. Another case, a 93-year-old male, no vaccination record, and previously he had some pneumonia. On 25th of August, his family found that he was lying unconscious and was sent to A&E. A&E conducted RAT positive, and the PCR CT value was 16. He was admitted to hospital and prescribed Reservidir. At the same time, he had coronary congestion, that is a cardiovascular disease. On the 29th, there was a heart failure. The cause of death was cardiovascular disease and COVID. Another patient, a 70-year-old male, hypertension, diabetes, high cholesterol. And 4th of August, he attended A&E because of dizziness, chest pain. He was tested positive by RAT, CT 16.5. After admitting to hospital, he was prescribed Reservidir and oral medication. There was some progress. The CT value had approached 34.9, and at Wang Daixin Hospital, he was prescribed rehabilitation, but then he died on the 29th of August. Another 85-year-old female had hypertension, gout, asthma, heart failure, cognitive defect, and on 27th of August, RAT positive. She did not seek medical care. On 29th, she had shortness of breath and attended A&E. A&E intubated her, and after admission to hospital, the CT value was 12.3, very low. She was prescribed Reservidir. And on 29th of August, not too long after admission to hospital, she had heart failure and was not able to resuscitate, and she died the same day. The 10th patient is a 54-year-old male. This patient had terminal lung cancer. After admission to oncology ward, in the interim, we tested PCR and it was positive. He was prescribed Reservidir. And because of his lung cancer, even though he was 54 years old, the doctor's diagnosis of cause of death was lung cancer. Moving on, another 82-year-old male had a record of prostate enlargement, cancer, uh, pneumonia. On 10th of August, he sought medical care because of coughing, and he also tested RAT positive, and CT value was 17.2 via PCR. On 16th of August, he had difficulty in breathing, had coughing and phlegm and fever, and after admission to AE, his CT value was 23.8. He was prescribed Reservidir, but yesterday, 29th of August, he deceased. So after reviewing the patients, some of them have no vaccination records. Some, after being infected, they sought medical care at a late stage. So we urge everybody get vaccinated and seek medical care as soon as possible. Conduct testing, and you also need to get oral medication for COVID. And the last day, we had 304 patients that recovered, and 263 of them were discharged, and 5 patients were tested positive after admission to a hospital. 8 ward patients were diagnosed as close contacts. 182 staff were infected, and we have 57 staff who have returned to their posts. One Princess Margaret cluster, we need to inform you. Princess Margaret internal medicine and gerontology, a 76-year-old patient, male patient, on 27th of August was confirmed positive. The hospital conducted tracing and found 6 more male patients between the age of 46 to 83 and 3 staff members. So these people are being quarantined. They're stable. The 3 staff are also stable. The hospital is investigating the connection between the cases. The ward is now not admitting new patients, and it is being disinfected. The hospital has also arranged for all patients in the ward to be tested. The hospital will continue to follow staff and patients closely, and will stay in contact with the Center of Health and Protection. So I also want to remind you that HA patients, we have conducted some analysis. Just now we said that we have some 2,580 plus 2,500 plus patients, and 2,100 of them are aged 60 and above. So it makes up 80%. They are elderly patients. And we see that the elderly patients, it's a phenomena. The oldest patient is above 100 years old. The median age is 77 years. So patients that are being admitted are seniors. You understand that the elderly, typically, they have a lot of chronic diseases. We see that they're in poor condition. They need to be admitted to hospital. They have to be monitored closely. We want to prevent the situation from deteriorating.
And about 240 odd of the patients require oxygen treatment. 23 require the assistance of ventilators for ventilation. And among the inpatients, 65% of them are over 60 years old. That is among the the daily new patients, 65% of them are over 60. As announced, 92 patients are either critical or serious. 85 of them are over 65, accounting for over 90%. So most inpatients are elderly with chronic illnesses, and they already have a lot of underlying diseases. If they contract COVID again, their condition can deteriorate very quickly, and they require hospitalization for close monitoring, and they should be administered drugs as soon as possible. And we have to deal with their other diseases as well. So let me appeal to you once again, do not take the current wave lightly, in particular for young and elderly patients. Their immunity is weaker, and there is a high risk of complications, serious conditions, and even death. So parents should vaccinate your children as soon as possible. You should monitor your own health condition, and if you feel unwell, do an RAT at once, and also see a doctor. Whether you are RAT positive, negative, you should see a doctor at once if you are young or old in particular. Thank you, Dr. Zhuang. Yesterday, we had a total of 8,611 positive cases, 2,662 by RAT, and 5,949 RAT positive and verified, with 233 imported cases, 205 PCR positive, and 32 RAT positive. We have 237 imported cases, 83 identified at the airport. Samples taken on day 1 and day 3, and also cases picked up at quarantine centers 43. Those picked up positive on days 4 and 7 at community testing center, 94 cases, and those picked up after on day 10 and day 8, 17 cases. Most of them are repositive cases. The following India 24, India 25, UK 24, Thailand 23, the Philippines and Singapore 19 cases each, USA 18, Indonesia 13, Canada 11. For the remaining 44 places, they have reported less than 10 cases. As reported by Dr. Lau, we have got 13 cases of death reported. In the fifth wave, we have a total of 9,468 death cases. We've also got cases from care homes, 6 homes for the elderly, and 2 from residential camps for the disabled. And quarantine is required. Tonghua Group Hospitals, Lorman Fun Elderly Home in Shatin, 1 resident confirmed, 2 residents have to be quarantined. 瑞安護老院護老中心 in Shatin Way, 1 resident confirmed and 1 resident quarantined. 康雅護老院 in Wan Chai, 1 resident confirmed, 11 residents quarantined. 光年護老院 in Kwai Chung, 1 resident confirmed and 3 residents quarantined. 軒里手護理院 in Sam Shui Po, 1 resident confirmed and 2 residents quarantined. 海逸居 in Kowloon City, 2 residents confirmed and 1 resident quarantined. Another 2 彩怡之家有限公司 in Kwun 1 resident confirmed and 6 quarantined. 福康苑天耀之家 in Yunnan, 1 resident confirmed and 6 residents quarantined. These 2 are care homes for the disabled. For schools, today is Tuesday. 140 schools have reported 319 positive cases to us, affecting 238 students and 81 teaching staff. They come from 77 KGs, 33 primary schools, and 30 secondary schools. 28 schools have reported 2 or more cases to us in the past 7 days. We've got 7 schools where class suspension has to be done for 1 week. 保良局賽計有學校 in Sam Shui Po class 3E, 24 students in the class and 3 confirmed. Class 8E has to be suspended for 1 week. South Island School in Southern District, 11K2 class with 17 students and 3 cases confirmed. Class suspension for 1 week for this class. 嘉德麗 Kindergarten in Kowloon, class LA AM session, 17 students in the class, 1 student and 1 teacher confirmed. Class suspension for 1 week. 香港 Melbourne International School in Tai Po, P2B class with 22 students, 6 students confirmed, class suspension for 1 week. YWCA 安定幼兒學校 in Tuen Mun, 22 students and 1 student and 1 teacher resident. 宏立書院 2 classes, 1 class is 禮 3 students, 3 students and 3 confirmed, and class 三和 3 students confirmed. 一禮 class 一禮 and class 三和 class suspension for 1 week. 英藝 kindergarten in Shatin, class N1 with 12 students, 1 teacher and 1 student confirmed respectively, class suspension for 1 week. For KG in Tung Chung, KM and EM Ban, class started suspension on the 28th. 1 student, confirmed teacher confirmed, another 3 in KM, class KM, PM, K3 PM class, class suspension for 1 week. And for the sublineage, on the 27th, samples collected on the 27th, suspected BA4, BA5 rose to 56.6%. Now, we believe about 49.5 of the cases are BA4 and 6.7 BA4, 6.1% are BA.2.1, 2.1, and BA 2.2 about 37.7%. So BA5 has accounted for most of the cases as the mainstream subvariant in Hong Kong now. I open the floor to questions. Please use our microphone and introduce yourself and your organization before you ask questions. The lady in the front. I'm from cable TV. There is news that Dr. Albert Au is positive. I'd like to know whether that will affect the work of CHP, and when did Dr. Zhuang last seen him? Will you require quarantine? And this morning, in Changsha 168 did not there was enforcement operation, and 168 were found to have violated the regulations, but only 24 were fined. What is the reason for that disparity treatment? Now, if that 24 persons have done PCR ultras, does that mean that they don't have to be fined $10,000? Now, for buildings requiring CTN, we have 168 who did not comply with the notice. Does that mean that we have to step up enforcement? Now, there is a 83-year-old male who passed away. I'd like to know whether he had ever seen a doctor. Did his family know? Did he report his case to the platform? Now, a new term will start on the 1st of September. Do you expect another surge in the number of cases? Will that exceed 10,000? You have asked more than 3 questions. Now, the trend is cases from the community will continue to rise. And if we have RAT, when the new term starts, we can stop the spread in schools. And I heard from colleagues that is, you refer to the enforcement. I think 24 persons were immediately given fixed penalty tickets. For the remaining 100 or so persons, there will be follow-up action because further information has to be collected before follow-up action can be decided on.
The information I have is the patient lived with his family, and he would not accept medical care or medication. I don't have the details, but I want to tell everybody that 60 or above, 70 or above, these people If they are infected with COVID, we will phone them to ascertain their condition, and if necessary, we can arrange a clinic visit or remote diagnosis. But some cannot be reached by phone. They did not pick up the phone. We left a message. They did not respond. I understand they might not be aware of the messages. We would like them to respond. We also have SMS messages, and they can contact us via that. We also see some patients. We tell them that they can be arranged to see a doctor or have a remote to visit, or they can also visit designated clinics, but they refuse. They might feel they have mild symptoms. They might rely on TCM. First of all, we respect patients' decision, but we want to tell the public that if you have early oral medication, then it can prevent severe symptoms or admission to hospital. It can reduce that significantly, up to 80%. So that means they don't have to be admitted to hospital. They can avoid death. They can avoid severe symptoms. So we can arrange for delivery of medication, a medical checkup. It's not a long course that you just need 2 doses per day for a few days. Some might feel that they're okay after a couple of days and stop medication. So we want to urge the public. If you see a doctor and receive medication, you should take the full course. Speaker not using a microphone, not coming through. I will not respond to individual cases. Next question.
First one is for Dr. Lau. For the triple jabbed 84-year-old female who died in the A&E, how has been her symptoms, and are they similar to those who were not triple jabbed? And are these 3 doses still not enough for elderly people in general to prevent COVID? And also for Dr. Chuang, as BA.5 has been the dominant strain, how does it affect the COVID situation? Do you expect the cases to top 10K within this week? Thank you.
We all understand that BA.5 has been the prevailing strain in many places over the world, and including Hong Kong at the moment. So we understand that BA.5 is more transmissible. So this may cause a further increase in number of cases as the BA.5 further increases. So it is within our expectation that the cases number will further increase.
For the 3 cases who died in the accident and emergency department, actually 2 of them had not received even 1 injection of the COVID vaccination. So this is one of the most effective way to protect our patients as well as the citizens against the COVID-19 infection. At the same time, we noticed that one of the patients who did receive consultations as well as the oral antivirals after the onset of the symptoms and the positive antigen test. I have not enough information to comment whether what has happened between the after taking the medication and the onset of the SOP and go to the A&E. But I want to have some reminder to our patients that even after you take the medications, including the oral antivirals, if you still have the symptoms of, for example, shortness of breath, cough, or increased tidiness or increased symptoms that is not relieved by the oral antivirals, please go to see the doctor again, because sometimes you may have other problems. Sometimes you may need even hospitalization to tackle the problems.
下一位，嗰邊就。
And now TV, I also want to follow up on the Cheongsa-wan mandatory test building and law enforcement action. So 24 people were issued a fixed penalty notice, and previously only 4 or 5 people would be penalized. Why do we have such a uptick of cases of 24? Is the government enforcing the law more strictly? And regarding Princess Margaret cluster, what is the source? Did the nurses come into contact with other patients? Regarding law enforcement, we will take action when there's proof. If we need to collect more proof, then we have to follow up. I have nothing else to add. Currently, we don't know what the source is. We identified a few patients. They were, after the admission to a hospital, they were tested positive. So we don't know if they were infected outside and or did they get infected in the hospital. Some staff, they might have been infected in the community. So we need to clarify the chronology of events. We'll also conduct DNA testing to see if it's the same strain. So I cannot give you the source right now. Most importantly, we need to, after this testing, we have to identify the patients, the infected persons, and reduce the transmission. And we need to disinfect the ward. We have to prevent the spread of the virus. TVB. Just now, Dr. Lau referred to a 90-year-old patient. His CT value was low. So at the time, was there any arrangement for admission to a hospital? Did they refuse that option? And I want to follow up with Dr. Chuang. We see in Shenzhen, there is a new strain of BA.1.5. Shenzhen mentioned that the DNA might be similar to BA.5. So have you received any information from the mainland counterparts? If this BA.1.F is transmitted to Hong Kong, will the cases go up? And you also had a case yesterday, and we'll have more and more of these cases. So do we see that this second round of infection, will they have more severe symptoms or similar symptoms? And the medication, will there be any special arrangements? Can oral medication cope with the new strain? Given the situation in the community, is it still feasible to resume school? And if we have some 8,000 cases per day, do you have any advice for schools and parents? Regarding the Shenzhen case, I'm aware that it is a BA.5.2.1. It's a BA.5 subvariant, and I mentioned that around the world, the majority of places have BA.5. It's the mainstream variant, and Hong Kong is starting to have this as the dominant strain, and it is in line with the global trend. Hong Kong has done a lot of work to prevent the spread of disease. We have in Shenzhen Bay at the border control where people have to do a special PCR test to prevent these cases from spreading into the mainland. For example, since August, we have conducted some 61,000 tests, and we prevented 385 cases, positive cases or uncertain cases. So these did not leave Hong Kong. And we also received feedback from the mainland that during this period, there was one case that had been stopped on their border.
With regard to the second round of infection, the figure is about 1 to 2%. We have not seen a substantial rise. But then, as we are farther and farther away from February and March. Some may be infected for the second time. After all, it's been more than 6 months from now. Now, for cases of second-time infection, now because we do not have too many in total, so we have not seen any obvious difference in symptoms. About 65% of them are in between 20 and 59. For those who are over 60, they count for 20 odd percent. Those who are younger than 9 or younger than 19, perhaps Dr. Lau can supplement on the question of second-time infection. Now, we do not have too many inpatients who are infecting, who have who have contracted disease a second time, and the treatment is similar to those given for COVID patients. Now we'll see whether any antiviral drugs or oral COVID drugs should be given. And also if there are problems with their lungs, we will provide appropriate treatment, including steroid. For that 39-year-old male, we have no information on whether he refused or not. But then looking up information, he complained of coughing and his chest x-ray was fine. So it depends on the clinical situation. If clinical conditions warrant inpatient treatment, he'll be hospitalized. And if his oxygen level is low, then we will provide oxygen therapy. But then her oxygen concentration was recorded to be normal. So inpatients are usually more serious cases. Inpatients that may require a different protocol of treatment. Now, for this patient, he was stable when he consulted a doctor. Only coughing was present, and then he was given oral COVID drug without hospitalization. The speaker was off mic. I understand that the Education Bureau has made some arrangement, and we've not seen our other proposals. I'm from Phoenix TV. The chief executive is going to Shenzhen to discuss with Guangdong reopening of borders, and there are views that to reopen the borders, perhaps quarantine on our side of the border can be done. What is your view on that? Now, we have quite a number of cases already. Do we still have quarantine facilities to serve that purpose? I understand that the matter is being discussed. I don't have any detailed information and I have nothing to add. The gentleman in the middle. Good afternoon. I'm from Mingpao. I'd like to ask Dr. Lau. Yesterday, there was the case of the 17-month-old baby. What is his condition now? Does he still require intubation? And has any genome analysis of his virus done? And then yesterday, we're told that there could be 230 beds in AWE. Yesterday, occupation was 190. Now, for one case, a few days after taking COVID oral drugs, the case was still positive. Does that mean that a full course is required? What was his result of RAT at home? Would HA require patients to take an RAT after completing oral drug? Now, for that case, that was before the 25th with quarantine facilities or isolation facilities for the elderly. Could that case be prevented now? Now, for the 17-month baby, it is still on a ventilator and intubation in PICU because he was in deep sleep, and then we are worried that breathing might be affected, and therefore he's on ventilator and also intubation. I have no other information with me now. AWE. We planned to open 200 beds. We have already activated 190 beds, so it's almost full. Apart from AWE, we're adding beds in some other facilities, mainly in our cluster hospitals. We will convert the use of some wards to receive COVID patients. We will monitor the situation in AWE. It is one of the places for us to add beds. Opening new beds in our cluster hospitals may be better in terms of manpower deployment, because if we operate AWE, we'll have to redeploy staff from our cluster hospitals. So we'll work out which solution is better, and also the bed utilization in our different clusters. There are 7 clusters, and then we will monitor the overall situation. Hopefully, we can maximize the use of beds. As for that 93-year-old male patient who passed away, I don't have information as to whether he had done an RAT again at home. But I think that's a requirement of CHP. All confirmed patients are required to do RAT again. And for those who have never been vaccinated, they have to stay home at least 14 days before they can go out. For those who are over 70 with 1 dose or no vaccine injected, if they're confirmed, they'll be sent to places where treatment can be provided. Right now, the facility is at Penny's Bay. We have service units catered for elderly persons. We have converted some of the facilities with an alarm to alert nurses, and will monitor the situation. The thing is, people should be vaccinated. Now, once you're not vaccinated, your condition may worsen. Even if you stay in particular facility, that doesn't mean that your condition would not worsen. You will be monitored there, and somebody can ensure that you take medication. But if you have received vaccines, that means your condition might not worsen, and you don't need to go to a facility. I'm from HKET. Now, for the last 4 cases of death, I think you did not tell us their vaccination record. Can you please supplement? Now, for cases of death today, many of them had hypertension and hyperlipidemia is the cause of death. And what do you expect the number of cases in September? Now, in November. Now, if the number of cases are still high, do you think you will have to delay the resumption of whole day classes? Now, there are some. We have more restriction and testing operations. What is the criteria for restriction and testing operations? Now, I cannot predict the development of the pandemic. I can only say that it is on a rising trend. As for restriction and testing operations, we have never stopped doing so. For the last 4 cases of death, a 70-year-old male with 3 doses, an 85-year-old female, 3 doses, 54-year-old male, and that is the case with lung cancer, 2 jabs, and 82-year-old male, 2 doses as well. Hypertension is a chronic disease, and so is hyperlipidemia. These chronic diseases can affect the immunity of patients after contracting COVID. They are more likely to worsen, and there is also the risk of death. So those who are younger than 65 with chronic diseases and with poor immunity and chronic diseases that require regular medication, these patients should see a doctor as soon as possible. So they may have to take oral COVID drug to stop the deterioration of the disease.
just now you referred to BA.1.F. It is a BA.5 subvariant. So has Hong Kong more data on the situation, or do you just categorize it under the BA.5 subvariant? And regarding suspected infections, how many of them are reinfected Omicron patients? And if they are reinfected, do we have death cases and severe symptoms? Now, regarding resumption of school, will you provide more information? Can you inform us in the daily reports? And lastly, I want to confirm CHP, do we have staff that are infected? We don't have data on how many BA.5.2.1 cases we have in Hong Kong. We do have some DNA analysis, and we do see BA.5.2.1, but we don't have statistics. It comes under BA4 or 5. Regarding the suspected infected cases, we need to conduct further analysis on the symptoms, severe symptoms, and so on. Theoretically, we need schools on the first school day. We need them to report the number of infected cases. Last question.
Questions from the South China Morning Post. The first question, does the government currently have any guideline for exempting people with disabilities and children with special needs from hotel quarantine if they requested so they can isolate themselves at home? And also some more questions about the adjusted vaccine requirements from the Education Bureau today. The government recently changed the vaccine requirements for secondary and primary schools. Would this measure be too late to address the current outbreak of COVID-19 because it is starting from November? How would the CHP balance the need to address the pandemic and the potential effects that this would have on students through the suspension of full-day face-to-face classes and activities? And also, with the increasing amount of cases, will the CHP also consider further measures like the suspension of face-to-face classes, despite some experts warning against it? And also, that's all the questions. Thank you.
I understand the Education Bureau has advised some prudent measures to prevent the spread of the COVID into the school, such as testing before they go to school. So I have no other comments on that. And for the isolation, you mean isolation or quarantine measures?
Isolation of for people coming in from overseas.
So you mean the quarantine measures?
Yeah.
Quarantine measures for travelers, if they have special requests, I understand our colleagues will consider on a case-by-case basis.
今日記者會完結，多謝大家。